I cannot tell you how many times I have told people what I do and they say, "Oh, yeah, I thought about trying acupuncture, but I don't like needles." It's a common response, so much so that I name this podcast, "But I Don't Like Needles." It's about a lack of education about the benefits of this medicine and about what this medicine encompasses. It's the fear of the unknown blocking people from getting the relief they're seeking. And to be honest, I've got tired of explaining to people what it feels like, why it's not like the needles they've experienced in the past, and how it works. So here I am throwing all of this out there for all to hear and to digest. Acupuncture is only a part of this ancient traditional medicine that has been used for centuries. It is also a philosophy, a lifestyle, and it's a personalized diagnostic tool and a world of customized herbal formulas that have little to no side effects. It's triggering your nervous system, your lymphatic system, your arterial system, and your muscular system to activate and do what it does best. Your body wants to be in alignment where you'll find optimal health. But sometimes it needs a little trigger, a tiny little stainless steel trigger. So if this resonates with you or this sounds like someone you know, then share this podcast. No one should be suffering when they don't have to be. A little education goes a long way and could be the start of a new chapter for you or someone you love. I am Dr. Noone, and this is But I Don't Like Needles. Hi there, I'm Dr. Melissa Noone, and I'm here to talk to you all about acupuncture. So here's one of my favorite things. I've been doing acupuncture now for over 15 years. I see over 50 patients a week, and I own 2 clinics in San Diego, and it kills me when someone comes up to me and says, "Oh yeah, I believe in acupuncture." Okay, so acupuncture is not the Loch Ness Monster, it's not the boogeyman, and it is something that's been around for centuries. I mean, it's not something to believe in. It's actually a medicine that's been proven and has had clinical studies, not only in this country, but even more so in other countries. And it has been proven to be effective over and over again, which is why I'm still in business. So there are more and more acupuncturists multiplying every year because people are starting to really recognize that there is something very important about this ancient medicine that we need to incorporate into our biomedical paradigm. And so I'm going to talk about that, and I'm going to walk you through how it works. It's not voodoo. It really isn't. It makes very clear sense. And I'm going to walk us through the different ways of looking at it, one through the East Asian medicine paradigm and one through that biomedical allopathic paradigm to kind of get our brain around that. So first of all, if you're going to look at East Asian medicine, you want to think about the fact that it is based on qi. And when we think qi, we think life force, or you can also say energy. And energy is a loaded word, right? You can look at it from one angle and think of it very scientifically, right? The old Krebs cycle, making ATP, specifically using oxygen and water and carbon, all the other molecules necessary to do so. We think of energy, and in that kind of way, we think of solar energy and magnetic and gravitational and nuclear and all different types of energy that we might not see, but we definitely know is real and plays upon us on a daily basis sometimes. Now, when you look at it through East Asian medicine and you start thinking of qi and energy, all of a sudden it becomes something weird or kind of wackadoo. And I don't really quite understand that because it is something you can feel very strongly. And you can't really explain that as much until you honestly have done it. It's kind of when you walk into a room and you feel the tension in a room. Not one person has said anything, but it's just thick. You know, the air is thick. You feel you're not welcome. Or you walk into a room and right the opposite. It's fun. It's jovial. You feel that, oh, I feel good here. I feel welcome. That's something that you definitely feel. And that's something that we can say is legitimately something we can all experience. And that is kind of that life force. If you look in Hawaiian cultures, they talk about that life force. The aloha is literally the breath that you exchange. And breath is a big part of the energy or the movement or the qi. And that is why in a lot of East Asian cultures, they have a lot of cultivation of breath work and qi and about using qigong. And when you look at yoga, everything is connected to the life force, to the breath. And breath is necessary for mitochondrial function. You cannot have cellular function without oxygen and breath. So it's really not as voodoo as we all like to think energy is. It is a legitimate thing, and we have different types of it. And you will experience that when you come in and actually do acupuncture. Now, when it comes to the theory behind it, it's based in East Asian medicine around the Tao. And the Tao is about nature. And we are a part of that, and we partake in that, and it affects us. Not only does it affect us, but we can all agree that, hey, I have rougher time in the fall because for some reason the fall allergies kill me, or someone else is worse in the spring, or someone else says it's winter, I cannot handle the cold, my pain, my joints, my back, These are all things where external environmental factors affect us, and that's valid. And we need to keep that in mind when we are doing diagnostics. And not only with seasons, that's just part of it. In East Asian medicine, it's a beautiful thing because it's all empirical evidence. It's all by observation. We're talking centuries upon centuries of meticulous, detailed observation of how the body reacts and responds. And when it comes to different seasons, when it comes to different times of day, when it comes to different constitutions, when it relates to the actual feeling when you feel pain here, how when you press, it affects a different place there. And that leads us also to what they map out, which everybody may have been familiar with, which is the meridians or the channels. They have been vetted out now over centuries because they actually have credibility the more that we've learned about the inside and the anatomy of the body. Because if you lay out meridians and channels, which are these little maps that go over the body, what they found empirically is that if you press here, you'll affect a different counterpart elsewhere. And the channels were, by observation, they connected because they, again, were mirroring the nature from outside. When you look at outside, everything is connected. You think of the rivers and streams, for example, they ebb and flow and they nourish the land and the earth. So that is what these channels are doing. They are nourishing. And when you look at a stream, for example, that's up a mountain and it gets obstructed, let's just say a tree falls. Next thing you know, you have obstruction there that's going to cause havoc, which is going to cause discomfort, cause pain. And moreover, it's going to cause deficiency and malnourishment lower down below the stream. So the goal of these channels and meridians and the whole concept of acupuncture and wellness is to clear out those obstructions and to give nourishment to where there's deficiency. That is the basic concept of that. And when you think of that in a biomedical way of looking at it, it's counterbalance. When you look at two kids on a seesaw, for example, and you have one kid who's sitting on it and the seesaw's not working, you're not going to keep putting more on that one side. You're going to put a kid on the other side to counterbalance and bring that other kid up, right? So it's not always about where you're feeling the discomfort or pain or misalignment. Oftentimes, it's somewhere else that we need to apply attention and in order to find that balance, right? That's the idea of the meridians and the channels. Now, how do we do that? Well, in East Asian medicine, they used to use just pressure, which can be useful and helpful, especially with children. But the other way for stronger manipulation of this kind of balance is using stainless steel needles. Extremely hair-like, tiny, thin needles that literally, if are applied correctly, don't feel. They go in and they will, though, trigger a electrical impulse response. So the thing about these channels that are so amazing now, centuries later, after we now know that they lay over our other systems in our body, we can parallel them to the systems that we do know biomedically, i.e. the arterial system or the nervous system or the lymphatic system, right? So if you have a trauma or some sort of blunt trauma to the body, there's going to be havoc, blockage there. Yes, you have discoloration, you have bruising, you have inflammation. Next thing you know, you have blockage and there's going to be pain, and that's going to affect other parts of the body. So we need to remove that obstruction. Sometimes it's something very clear, acute that you see, but oftentimes it's not. It's something from misuse. If we're sitting all the time and we're putting our bodies into a seated position, for example, we're going to be too tight on the front. Muscles on the front of the body, the iliopsoas and the rectum, they're all going to be very tight, and that's excess, and that is going to be blockage, and that's going to mess up and throw off the back side, which is the deficient side. The antagonist muscles, if you will, perhaps the lumbar, perhaps the piriformis specifically, or the glutes, or, the biceps femoris, the hamstrings, things like that. Now, those are going to be out of whack because of the excess from being in a seated position for so long, which our body's not meant to be in. So when you do things over time that throw off this kind of balance, it's going to cause this excess deficiency scenario. And then you come to us, we recognize that, you see that, you can release those excesses, and then you can work on strengthening those deficiencies. PT does this, they just don't do it through our channels. And the channels are magic because, in some ways, not only do they address the muscles and the superficial level, but they also do integrate into a deeper level, and they do affect the organ systems. So every channel that you have, that they're 12 primary, is that they will affect the different organs that they are attached to. So if for some reason physically you are in excess or deficiency of one of these channels, that is also going to affect the internal. And I know that's a leap for some people to understand, but think of it this way. When you have level of the spine, everything comes back to the spine. I still believe that when it comes down to it, because the nervous system comes through the spine, and the different levels of the spine will infiltrate the different organ systems. So for us, those different levels of the spine do relate to the muscles that attach to it, but then also those relate to the different organs that go in. So when I'm needling the different levels of the spine, or if you go to a chiropractor and they adjust a certain level of the spine, that's going to affect the nerve conduction into that organ system. And it's also going to affect the blood flow as well. So I mentioned the arterial system. If you have a neurological issue, let's just say there is something not firing, something's misfiring, and there's some sort of deficiency, that is going to affect the channel along that line. And oftentimes that is along the dermatomes that we are aware of in biomedical medicine. And if you are looking at the lymphatic system and you have a backup, you are going to recognize that there's going to be all sorts of havoc that is going to happen if you're not, because your lymphatic system, for those that need to be refreshed, is about cleaning out your body. It's getting rid of the things that you need to get rid of. And it is full of our white blood cells and our immune support. And if we don't have a good flow with our lymphatic system, now we're having an accumulation situation. And now we are having cysts and pockets of growths, as well as infections and all sorts of havoc. So we must, again, move that lymphatic, clear the obstruction, and make sure to get it through the body where it needs to go. So with that in mind, understanding that these little tiny stainless steel needles have an electrical conduction to them, and our body works on, the nervous system works on that kind of conductivity, we are going to have a little bit of micro traumas, if you want to say, with that stainless steel needle, will trigger a cascade of reactions, which will be helping the body to heal itself, to clean out the area, and bring things that are going to fix that. So before I wrap up, I think it's very important to also touch on East Asian herbs and how that is a part of the medicine. I know that there are many people afraid of taking East Asian herbs and formulas, and we will go into an entire episode about that, but I do want to touch on why they're important. So the herbs are a big part of this medicine, and they are like food on steroids, basically. Just remember that food grows in certain areas and climates because it can. It's learned to adapt to survive in those areas. So if you are in a swampy area and things grow, then those things can handle the swamps. And if you are in the desert and you eat things from the desert, those things have properties that help to survive in the desert. And so all those kind of food is thy medicine, this is taken to a whole new level when you can actually take these Chinese East Asian herbs and you can pick them apart because they've been studied for centuries meticulously. Every herb, just like every food, has a temperature, a flavor, it has a function for what it does. it will affect everyone a little bit differently, and you need to understand the pattern it treats. And so when somebody says everybody should be taking ginger, or everybody should be taking turmeric because everybody's learning about these herbs now that have been around for centuries, you want to be a little bit more mindful and maybe discuss this with someone who actually has studied this for years, because it's usually done in combination in formulas and specifically catered towards the individual so that the person gets well. East Asian medicine is about the person, treating the person, and not the illness as much as it is the person. Every illness and diagnosis has multiple patterns and maybe even a combination of patterns. And so it's important that we look at you specifically. This is why you have multiple medications in biomedical medicine to treat the same diagnosis. And they don't necessarily understand why, but they will know that not all these medications work for every individual, which is why they have multiple choices, either for treating hypertension or different cholesterol medications or anxiety medications. They don't necessarily understand why they don't work well with certain people, but they know that different people need different medications. And that's what I love about this medicine, is that we go a little deeper into the individuals and the different constitutions and can actually give a little insight as to why certain medications are going to work better for them than others. Thank you for listening and being a part of the conversation today. If you enjoyed it, please like us or leave a comment in the comment section. We would love your feedback, and we are open to topics that you would like to discuss. And better yet, if you know anyone that may benefit from this information, either they're suffering, they're in pain, or they're just curious about trying this medicine, but they don't like needles, please share this podcast. As I always say, wellness is as contagious as the flu. I'm Dr. Noone, and this is But I Don't Like Needles. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institutions.